clear one thing up right quick. Number one, Kids Care is not Medicaid. Kids Care is part of the S-CHIP program, and that is a different program, and it's funded a little differently. It's not an entitlement like Medicaid is. Number two, insurance is not medical care. I want to just emphasize that. Insurance is not medical care. It's just a payment mechanism. It does not determine whether or not you get good quality health care, whether you get enough health care, whether you have access to health care. None of those things are determined by insurance. In fact, as Dr. Singer has already alluded to, it can result in less access. It can result in less care. In Great Britain today, where they have a fully socialized system, and that's the only word for it, well, it's not fully socialized anymore. They decided to let British doctors go out on their own to some degree and serve customers without going through the government system. It reminds me of the Soviet Union when they let farmers, collective farmers, farm their own little plots for their own families, and those little plots ended up feeding, because of black markets, more Russians than the collective farms did. Mark my words, that's going to happen in Britain with health care. Mark my words. Yes, I would love to talk about health care. The whole last minute of the doctor's presentation had nothing to do with health care. We're talking about health care, and we're talking about systems of health care. And I'd appreciate you not taking up my time, so I'd like 30 minutes added on, 30 seconds added on. There are 45.7 million uninsured people in the U.S. In 2007. 6.4 million are actually on Medicaid, but for some reason they report that they're not insured. 4.3 million are eligible for free or heavily subsidized government health care, but they choose not to get it. 9.3 million are non-citizens. 10.1 million have incomes over 3 times the poverty level. 5 million, and therefore I would argue could afford health insurance, and 5 million are adults between the ages of 18 and 34 and do not have kids. Now that leaves 10.6 million people that aren't included in that, in one of those categories. Number two, you know, the reason we need a rural doctor health care program is because of government interference. And I can point to my father's own experiences with that. Many government regulations, because of Medicare and Medicaid, came very close to eliminating his practice. And frankly, he was the primary care physician for 1,800 people in Archer City, Texas. Most of the government programs we have today, it was said that we neglect children and old people. Are you kidding me? That's what Medicare is. It's for old people. It's quite frankly Cadillac compared to most insurance plans and what most health care that people get. We do the most for children and people who are old age. We have, you know, a lot of people seem to be disturbed by some sort of a profit motive in health care. Well, I am proud, I am so glad that there was a profit motive in creating a drug to fight fungus infections, because my niece is alive today after being on chemotherapy as a result of leukemia. She got a lung fungal infection, and had it not been for the antifungal drugs developed within a half dozen years of her illness, she'd be dead today. Absolutely no doubt about it. There was some, the fact is that we're in a catch-22 today. The main issue in healthcare is its expense. It's expensive, though, because we don't pay for it ourselves. And, of course, we don't want to pay for it ourselves because it's expensive. Well, at some point, something's got to give. And to think that we're going to come along and say, oh, well, we're just going to all collectively pay each other's health care bills and everything will be better, it just doesn't work that way. Do you really want a doctor who's beholden to a loan program taking care of you, or do you want a doctor who has a pecuniary, an income interest in doing the best he can for you? I want the person with the best incentives, and that's somebody in a true market setting, a doctor that's in a true market setting caring for me. It was, it was mentioned that the question is health care a right? Well, I think that is a good question. And if health care is a right, just consider that if you have a right to health care, you have a right to other people's money, their talent, and their resources. You basically have the right to imprison them to your service. Are they really going to work for you under that circumstance? I don't think so.